Cervical cancer is a largely preventable disease, but not many women know much about it. There are a number of signs and symptoms that every woman should be aware of.
I have got no idea about any kind of symptoms.
As a guess about signs of anything wrong, you'd go discharge.
Maybe if your periods are much heavier, or they're changing, or there's a discharge.
You know, I think people in the age band from, say, 30 to 40 are at quite a high risk.
I think that it's women in their 40s and 50s.
I wouldn't know. I should have asked my doctor that, actually.
If there's any changes at all, chances are it's nothing, but you should always go and get it checked out.
The earlier cervical cancer is diagnosed, the better the outcome will be, so it is important to know the signs and symptoms. The most common symptoms of cervical cancer are any unusual bleeding from the vagina, particularly after sex or after the menopause when your periods have stopped, and persistent vaginal discharge that is blood-stained or smells unpleasant. If you experience any of these symptoms, tell your doctor, even if you've been for your regular screening. The chances are they're not due to cancer, but it is important to be checked as soon as possible. As well as being aware of the signs and symptoms, there are other ways to prevent cervical cancer and detect the potential signs to help prevent it developing further.
I've heard about this vaccine that they're saying to young girls that they can get now, but I don't really know much about it.
I think is available for girls over the age of 12. I think I'm right, or quite young teenagers, to prevent cancer, and I think it's a very good thing.
The vaccine is routinely offered to schoolgirls aged 12 to 13 and is available up to their 18th birthday on the NHS. It protects against human papillomavirus, or HPV, which can lead to cervical cancer. For women of all ages, the best way of reducing the risk of developing cervical cancer is regular screening. So all women should attend regular cervical screening, or smear tests as they used to be more commonly known.
The smear test isn't a very pleasant experience.
It is difficult to have any investigative stuff going on down there.
It's your private bits, you know, and you don't want to be getting interfered with in any way.
So it's lying there, and the nurse said to me, "I can't find your cervix." I said, "Well, it's up there somewhere. You know, I've not hidden it."
I go for my smear tests. Bang, clockwork. When I get asked, I go.
It's a miracle that some kind of admin, this mystifying admin somewhere, calls me to have the smear.
I mean, I've always been a bit of a hypochondriac, so I've naturally gone for every test possible.
You've always got to think, this could save my life.
It's something that you should never put off, that you should always do.
God, it's hard being a girl.
As our 5 fabulous women agree, having a smear test is not the most pleasant experience, but abnormal cells on the cervix don't usually have any symptoms, which is why it's so important to go for screenings regularly. If there are signs of abnormal cells, treating them is often simple and can prevent cancer developing. For more information about cervical cancer and other factors that you should be aware of, visit evapeel.org.uk.